O2 CUPE, SEIU Healthcare, and Unifor, coming together for this hospital staff we collectively represent.
Purple power! Purple power! What do we want? Respect! When do we want it? Now!
We represent 75,000 workers collectively in this province, and those workers are working harder than they've ever worked before.
SEIU is in the room today with CUPE and Unifor, and we're coming together as one voice.
The only way that we see that we can break through and achieve a negotiated agreement that respects our members is to work together in solidarity, and that's what we're fiercely committed to do.
C'est historique, hein? Ça s'est jamais vu. Moi, ça fait 20 ans que je suis dans l'union et j'ai jamais vu les trois unions ensemble. Et je crois que ça va porter fruit, oui. Je crois qu'on va aller loin et je crois qu'on va être capable d'aller chercher ce qu'on a besoin d'aller chercher pour tous les travailleurs et travailleuses en Ontario.
As unions, we all jive to look after each of our union. And when we join together and work together, it is fantastic to show the unity. And hopefully the employer, which at many times it seems like they have no common sense, they will come to their senses and start bargaining properly.
Ready to go! Ready to go!
Healthcare workers are under so much pressure right now, and we're constantly being asked to do more with less. And our workplaces have completely disrespected us.
We went to the OHA asking them for the things that RPNs need to have safe, supportive practice, and they weren't interested in that.
We should be all treated equally, whether we're paramedical, whether we're service, whether we're nurses, RPNs.
Together!
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 We're really confident that if we mobilize our vast membership, with a sticker day, asking them to wear a sticker Together for Respect on April the 11th, asking them to participate in noon-hour rallies in April 18th, and if necessary, participate in workplace votes on May 2nd. And if we can deliver on escalating actions, that we can strongly push the hospitals to do what they're currently reluctant to do, which is to negotiate agreements without concessions and which have the same wage pattern as they've freely given to others.
We're sitting here representing 75,000 people that are back at work. They're working hard, they're paying dues to have us here. Now we got to go back and make sure that they understand what this fight is about.
Our patients don't care what union you work for. Our patients don't care what your name tag classification says. Our patients and our families care that they get the best care possible.
We have started to engage our communities and our separate hospitals, and we will continue to do that. We're ready to go. We need the support of all of Ontario. And the last thing that we do or don't need is arbitration and settlements that are done in a room without us and without our members there, because we have to live with that.
I really do believe that in this room, we have the power to bring home respect and a real wage increase for these individuals.
We saw a great thing happen today, and that's 3 unions, the main unions in Ontario with respect to representing healthcare, get together and lay out a campaign that we're going to roll out on behalf of 75,000 healthcare workers in the province.
And this is about making it in the best interest of our employers to make sure that they know they better give us a good collective agreement, that they want to settle this, because we're not going to make their lives easy over the next 6 weeks or so.
Fired up! Ready to go! What do we want? Respect! When do we want it? Now!
Together!
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 Together for respect.